Bismillahirrahmanirrahim. Hello everybody. So a 36-year-old nulliparous woman come to the emergency department after a syncopial episode while at work as a surgical technician. Her colleagues gave her 1 liter normal saline before she arrived. The patient is currently on day 10 of her menses, which have become progressively heavier and longer over the past year at regular 28-day interval. Review of system is significant for frequent lightheadedness and palpitation. She is sexually active with her boyfriend and take combined hormonal contraceptive pills. Her temperature is 36, blood pressure is 100/60 and pulse is 112 per minute. Pelvic examination show an irregularly enlarged uterus that is 12 week in size. Her hemoglobin is 4.9 gram per deciliter and mean corpuscular volume is 75. Urine pregnancy test is negative. Which of the following is the most likely cause of this patient anemia? Cyclic bleeding of ectopic endometrial gland, within the myometrium, endometrial hyperplasia with atypia, impaired platelet aggregation, proliferation of smooth muscle cell within the myometrium, viral infection of the cervical transformation zone. So first of all, this patient came to us. This patient is 36-year-old woman which is nulliparous and came to the emergency department after a syncopial episode. This is the day 10 of her menses, which became progressively heavier and longer. Patient experiencing frequent lightheadedness and palpitation. The patient is also taking oral contraceptive pills and her BP is 100/60. On pelvic examination of the patient, pelvic shows irregularly enlarged uterus that is 12 weeks in size. Her HB is 4.9 gram per deciliter and mean corpuscular volume is 75. So this is iron deficiency anemia, and the diagnosis of this question is leiomyomata, uteri, which is also called fibroids. So here the correct option is choice E, proliferation of smooth muscle cell within the myometrium. Why the choice E is the correct one and why the diagnosis of this question is fibroid, leiomyomata, uteri? Because abnormal uterine bleeding is defined as menstrual bleeding that is prolonged more than 5 days and heavy more than 1 pad every 2 hours with an irregular frequency. Chronic abnormal uterine bleeding can result in symptomatic iron deficiency anemia, which in turn can present as syncope, palpitation, and tachycardia. Leiomyomata fibroids are a common cause of heavy menstrual bleeding. Proliferation of smooth muscle cell within the myometrium can cause profuse menses as well as irregular uterine enlargement. Oral contraceptive can decrease bleeding duration and volume but may not completely resolve symptoms. Come to the incorrect one. Choice A. So cyclic bleeding of ectopic endometrial gland is a pathogenesis of endometriosis, a condition that typically present with pelvic pain, not anemia. Heavy bleeding or an irregularly enlarged uterus. Choice B. Adenomyosis is the proliferation of endometrial gland inside the uterine myometrium. Clinical features include bulky uterus, tender uterus that is uniformly enlarged. Choice C. So endometrial hyperplasia with atypia is part of the progression to endometrial carcinoma. Typically presentation include postmenopausal bleeding with a normal size uterus. Choice D. So the hallmark of von Willebrand disease is impaired platelet aggregation due to a von Willebrand factor deficiencies. The coagulopathy can cause abnormal uterine bleeding and anemia but without uterine enlargement. Choice F. A human papilloma virus infection of the cervical transformation zone can cause cervical cancer, although focal cancerous changes are typically asymptomatic. Advanced cervical cancer may present as postcoital spotting with a normal size uterus, not with irregularly uterine enlargement. Thank you.